Hello, this is Dr. Drew Hall again from Los Angeles, Upper Cervical Health Care. Today what I want to talk about is TMJ. TMJ can be kind of an insidious condition. For some, they just have mild popping in their jaw, and others, they have such severe pain that they can't even eat. They have to actually suck their food through a straw. And of course there are other symptoms that are associated with it, like radiating pain into the ear. Lots of people have headaches. Quite often cognitive issues are connected. What I want to talk about how the TMJ joint and the surrounding muscular system actually connects into the upper cervical spine from a neurological perspective. Now, there's about 10 million people in the United States that suffer with TMJ, and that's 1 out of 30 people, so it's a fairly common condition. I myself, 23 years ago, it was one of the 30 different symptoms that I dealt with, which was corrected through Upper Cervical Chiropractic, and so TMJ hits close to home for me. So when we talk about the TMJ joint, there are 4 main muscle groups that actually control mastication. The first one is the masseter, the second one is lateral pterygoid, third one is medial pterygoid, and then the temporalis muscles. And for you lay people, I know that doesn't matter to you, but why that's important. All 4 of those muscle groups are controlled by the trigeminal nerve. And the trigeminal nerve is one of the 12 cranial nerves that comes off of the brain stem. Now it's actually, the nuclei is actually above C1, it's actually in the cranial vault. And so it may seem biomechanically impossible that a C1 problem, being out of position, can interfere with that nuclei, but let me bring you through this before I get into the neurology. Basically what happens in TMJ, you have a joint on both sides where the jaw connects into the skull, and it fits about like this. Now both sides of your muscles are balanced in their tone. When you eat, when you chew, when you talk, that joint's going to function symmetrically on both sides. Now what happens in TMJ typically is the muscles become tighter on one side than the other, and what that does is it pulls the jaw articulation or jaw joint, the TMJ joint, out of balance, and you get a closing off on one side of the joint compared to the other. Again, that's due to muscle tone imbalance. Now, I just kind of alluded to the fact that these muscles are controlled in the brainstem, the tone of the muscles. And so if something interferes with that nuclei, just like your shoulder muscle can get tight on one side compared to the other, or the low back or the mid back, you get an asymmetry in the muscle tone, and that causes the TMJ joint not to function quite the way it's supposed to. Now, how can an upper neck injury interfere with the trigeminal nuclei? So your head is 10 to 12 pounds. The C1 vertebra is about 2 ounces. And so as we go through life, there are car accidents, whiplash injuries, sports injuries, slip and falls. I not too long ago had a patient that came in that dove off his surfboard. He thought it was 10 feet deep, it was 2 feet deep. So there's lots of trauma that happens through life. And what can happen, sorry, I dropped my atlas. This is the C1 vertebra. This is where your head rests on. Your head, like I said, weighs 13 pounds. It sits on this 2-ounce bone. If you're in a trauma, that vertebra can dislodge, and the ligaments and soft tissue can actually tear, and the vertebra can become locked under the skull. Well, through that bone runs your brainstem, and around the brainstem, which is the spinal cord, is a sock-like covering, and connected to that sock-like covering are 2 little ligaments that attach to the atlas. So when the atlas dislodges and locks, that ligament puts torsional stress on the brainstem, and the first thing that happens is the muscles, the strap muscles on the side of the neck, scalene is one of them, they become tight, and from the side of the neck, you lose the normal cervical curve, so the cervical curve becomes straightened. We find that 80% of the people who have TMJ have lost their cervical curve due to the atlas misalignment. Well, guess what happens? When you lose cervical curve, basically the spinal cord has tensile stress. It's pulled down through the spinal cord, and that stress on the brainstem can affect all the nuclei in that area. It can cause your body not to work the way it's supposed to. So not only can the upper neck affect the mastication muscles, it can affect the muscle tone through the whole spine. And so in our office, what we do very specifically is we focus on this top vertebra, how it fits to the neck. We take three-dimensional, very precise digital x-rays to see how those joints fit to the skull and what direction it's out of position and how your joints are built. So we can then make a very precise correction to get that vertebra that's locked back under the body's control, remove that stress and pressure on the cord, and the body over time will start to go through a healing and recovery process. And over time, sometimes really quickly, people's TMJ type symptoms tend to fall by the wayside. It happened to me. It's happened to hundreds of people in our office. It's happened to thousands of people in upper cervical chiropractic clinics across the nation. So this is our short video on TMJ, how the upper cervical spine is related. If you or a loved one or an acquaintance are suffering with TMJ or other chronic health problems, it'd be a good idea to make sure that your atlas is where it should be. Make sure your head's on straight. Till next time, have a good one.